Hello, colleagues. I've prepared this recording for you as I am unable to attend today's staff meeting. Saying this, questions and comments are still welcomed as I would love to hear your feedback. You can pop them in the Zoom chat or send me an email. So my name is Christen Kong, and I completed a student placement here at Access Alliance with Excel and Sarah as my supervisors. I co-facilitated virtual mental health groups and learned about the organization's history with Expressive Arts programming. Following my graduation, I was hired and onboarded as a health promoter to further mental health programs and initiatives. I'm here to share with you a glimpse of the work that I have begun to take on. I will first start by saying mental health is a core component that is directly influenced by a person's social determinants of health. There is sufficient evidence in literature, but more so as healthcare providers, we have witnessed the impacts of mental health among our clients and the ways that it permeates all our fields. Mental health impacts the ability for someone to access, receive, understand, and respond to healthcare services. Therefore, integrating approaches that improve the mental health of our clients can enhance their ability to make healthier life choices that lead to an improved quality of life for themselves and their families. In January 2021, the Canadian government announced a commitment to develop a national action plan to end gender-based violence. The plan showcased the urgency of the issue, and it was co-created by a number of consultants consisting of community organizations and survivors, informing the change that they wanted to see. I want to emphasize two key messages from the report. The first is that the COVID-19 pandemic has exacerbated the challenges faced by survivors and increased their risk of violence due to isolation with abusers. And the second is that immigrant and refugee women experiencing gender-based violence face immense and unique challenges accessing services, including ineligibility of specific services, unfamiliarity with systems, language, and fear of deportation. So domestic-based violence is a layered social issue and requires a multi-pronged team-based approach. I am pleased to share that Access Alliance is contributing towards mitigating the impacts of gender-based violence among newcomer women. So this brings us to our second slide. I want to introduce you to the multi-year project called HEAL, Hubs for Expressive Arts for Life. This project is in its workings long before I was onboarded, so congrats to those who have contributed to the success of this grant. It was born out of Access Alliance's nearly 20 years of using expressive arts as an interdisciplinary health promotion strategy to address trauma, loss, and the abuse of newcomers. The art therapy techniques used in this modality transcend language and cultural barriers, helping the survivors express the unspoken horrors, increase their coping capacity, and regain confidence. In our own practice here at Access Alliance, there have been several documented cases in which expression through expressive arts led to the disclosure of experiences of family violence, and subsequently the interventions of our staff and allied service providers, thus preventing the participants from more abuse. The project is very much so a response to the increasing gender-based violence in our city and nationwide, specifically among newcomer and ethnic minority communities. It is also believed that gender-based violence is preventable. So essentially our goal is to develop an effective expressive arts intervention and identify promising or best practices to address trauma-informed health impacts of family violence and to improve participant physical and mental well-being. I want to now draw your attention to the left part of the slide to the four main objectives. The first is to deliver an interdisciplinary team-based expressive arts programs, bringing together partner organizations, peer leaders, and students. The goal of this group is to use art as a tool to facilitate movement from internal to external expression, from silence to voice, from disconnection to connection, and from disempowerment to empowerment. The second, the project team will tailor art medium tools and processes to inform best practices. The project team consists of two working groups, one focused on program implementation and the other on research and evaluation. They will be in constant communication during the 4 years to ensure annual project targets are met and they reflect participant experiences. The third, we are applying co-design and mixed method research approaches, using qualitative and quantitative measures to determine whether the expressive art intervention benefits and improves participant physical and mental well-being. And lastly, from data and evidence collected in the 3 fiscal years, we will mobilize this new evidence learned and recalibrate methodologies to contribute to the greater community of practice. So the women and gender minority populations we have prioritized in this project are extremely marginalized and have different intersectional locations. On the right-hand side, the intervention populations include participants speaking Bengali, Arabic, Tigrinya, Amharic languages, as well as adolescent female students at a secondary school level, women living in shelters, and the LGBTQ plus asylum seeker populations. Each of these 6 groups will engage in 12 sessions of an art-based program and complete an evaluation cycle up to 6 months follow-up. Recognizing the complex intersectionality facing our clients, disclosure is not the first step we expect from them, and it is not a prerequisite for receiving this support service. So it truly is through partnership that this project will come to fruition. The project brings together, again, peer researchers, community members, academics, community organization, healthcare providers like yourselves, and also an advisory committee to implement this intersectoral, creative, culturally safe, capacity enriching project. At its foundations, HEAL is an approach to intercepting domestic and gender-based violence. This brings us to our third slide. I will be using the soft pastel and pencil drawing drawn by an Expressive Arts Group participant to showcase how the HEAL project interacts with each of the 3 realms of society. A large part of a health promoter is to make connections and string together the intersections between the change impacts at the micro, meso, and macro level. So beginning at the micro level, where the grass grows and where the pencil people are occupying, represent the individual and interpersonal level. Here, we seek to create supportive environments and help develop personal skills. The expressive arts programs that we are currently developing desire to support participants' mental well-being and to provide a space for them to exchange wisdom, experiences, and relatedness. By doing this, it can enhance community connections and reduce social isolation and loneliness. Not only do these programs provide art-based activities, but act as another avenue for them to gain knowledge of their rights and available supports. This can enhance their personal autonomy and self-efficacy, building their confidence and resilience. Following the kite string, I want to draw your attention to the meso level, where the baby blue midsection of the sky lies. This represents organizational and capacity building. At this level, health promoters seek to foster community action and reorient healthcare services. The HEAL team will synthesize the findings and create various knowledge mobilization products for a variety of audiences using diverse dissemination platforms. We will host funding and resource development workshops as well as perform matchmaking between art therapy professionals and prospective projects. Our team will also provide mentorship and guidance to any HEAL members who intend to incorporate expressive arts strategies into their programming. This may involve actions including, but not limited to, increasing equity-informed planning and evaluation of programs and services, offer healthcare providers training to better support intersectoral needs. For specific mental health counselors, social workers, and health promoters, it is about increasing knowledge on expressive arts therapies to expand the options they can provide clients. And lastly, the HEAL project is inclusive of many stakeholders, strengthening interdisciplinary team-based care and community participatory research. So let's again follow the kite string. And now we have reached the darker, more windier part of the drawing where the kite is seen. At this level, health promoters seek to build healthy public policy. And like a kite, it oversees the people and organizations that are being impacted by its behavior and happenings. The HEAL project highlights the need to decrease siloed healthcare by including many stakeholders in the process of solutions thinking. By doing this, we will also actively participate in the community of practice initiatives, increasing peer-reviewed research on effective expressive arts interventions, and ultimately contribute to Canada's National Action Plan to end gender-based violence. So as seen through the kite string, the micro, meso, and macro inform one another from the person to kite, from individual to system. So on another note, I don't want to discount the balloon bouquet or the birds that you see in the image. If you have ideas as to what they symbolize, please share. I'm curious to your interpretation as it relates to our discussion on health promotion and impacts. And lastly, I want to end off by asking, what's the future beyond for the HEAL project and expressive arts programming? How high can the kite go? I've listed examples of knowledge mobilization products that enhance each of the three change outcomes. For behavioral change resources, this may include blog posts, community-facing reports, infographics, capacity building training, and resource development that can foster gradual and practical change for participants and service providers. At a practice change level, this may include tangible products, including the Stepping Up Toolkit 2.0, the project's final bilingual report, usable and adaptable intervention tools, again, service provider curriculums, presentations of our findings, and an online HEAL Hub network that will be used as a site where members can network and envision a future of collaborative expressive arts. And of course, we can't forget about policy change. The HEAL project has many implications to intervene, affirm, or suggest recommendations through the creation of policy briefs, peer-reviewed journal publications, and social action digital campaigns to engage leaders and policymakers towards a more sustainable strategy to address domestic and gender-based violence. The HEAL project is really at its beginning phases of development, so some of these future change ideas will become clearer as the years progress. I'm looking forward to the ebbs and flows of where it might take us, so stay tuned and thank you for listening. Enjoy the rest of today's staff meeting.